Okay. Hey, what's up, everybody? It's your girl, Aida Rodriguez, and welcome to this episode of Truth Serum. We were gone last week, took a little bit of a break, but we are back this week, and I just want to say thank you to those of you who are already here and ready to have this conversation. Before we get started with the actual show, I wanted to take a moment to express my thoughts about what happened in Atlanta. So many things can be true at the same time, and I think it is very important for us to have conversations that are honest and real with regards to our community. What happened in Atlanta was horrific, and the truth of the matter is that those are all results of white supremacy, and we see it in our everyday lives, in everything that we do, and it is constant. And now that people have started to point it out, it has become irritating to those who have been gliding in privilege for a long time and don't care to share equity and equality. I just wanted to say that there have been a lot of rifts within many communities in this country, and those rifts are all direct results of white supremacy. I've never seen, let me back up. Let me just, because that's getting caught up into this whole thing. A lot of people have taken the time to point out in this moment how uncomfortable it has been to be Black in communities with Asian people because there's anti-Blackness. Anti-Blackness is a global problem. It exists in all communities, including the Black community, and that is true. I am not going to speak on behalf of anyone. I'm not going to talk for people and say what you should or shouldn't do. No virtue signaling here. I will just say that I personally don't find it constructive to point out those things in the midst of what's going on now, when all of it is a direct result of white supremacy. So if Asian people were the people that were in power, then they would be held accountable, but they are not. They are also victims of white supremacy. And unfortunately, some of them, they are believers of the hype and thinking that light and white or being in proximity to whiteness is better. And, you know, we've had a lot of problems in our communities as a result of that. But what I'm not going to do is justify the murders of people who were taken down by a white terrorist in this country, who can be added to the long list of white terrorists in this country, and deflect and from that, because I think it is counterproductive to dismantling white supremacy in this country and in the world. And I hope that at some point we are able to find some solidarity and some peace. And I know that a lot of work is going to have to take place for that to happen. So with all that being said, I think it is horrible what happened in Atlanta. And at the same time, Gary, I think that it is horrible what's been happening to Black people in this country for hundreds of years. And I am not going to justify the murders of Asian people to alleviate the pain, because it's not going to fix anything in the communities of those of us who are descendants of slaves and American people who are the descendants of slaves. So I just want to maintain my humanity in this moment, because I think that when we start targeting one another, and mind you, we do it to ourselves, we do it to each other, we forget that white supremacy is really doing the work here. So my heart goes out to those people. There's a single mother who came here, who had 2 children, they have no other family here. It was violence against women, violence against a group of people who are also marginalized in this country. And this man was taken peacefully. His day was categorized as being a bad day when Tamir Rice wasn't even allowed to become a high school student. So I want to be able to call out things the way they need to be called out and still maintain my humanity, because I don't ever want to be that person. And you are welcome to have your opinion about this situation as much as you like. Um, and there's nothing that's going to happen that's ever going to justify what's happened to Black people in this country and in the world. So there's that. I hope that he is handled appropriately with the law. Um, Today, I want to have a conversation that is, I think, is an important conversation as we talk about these issues and we talk about mental health. I don't want to, I don't want to minimize my guest to just someone who talks about sex, because she's not. But she is someone who is actually out here doing the work when it comes to mental health, families, and the plight of the people. I want to read to you who she is, because I think it is important for us to give people their proper introductions. And she is a mother, an American soldier, a scientist, a physician who advocates tirelessly for healthy living to strengthen individuals, families, communities, and places around the world. She's an ardent champion for sound mental health and an expert in the development of evidence-based, y'all heard that? Evidence-based prevention, as well as treatment strategies that foster it. In her private practice, Dr. Thomas individual, couple, and provides individual, couple, and group therapy to address several issues, including performance problems experienced by serious amateur and professional athletes, addiction, sexual dysfunction, mood, and anxiety disorders. So I want to welcome Dr. Delvena Thomas to the show.
Hi there.
How are you?
I'm well, thank you. Happy Friday to you, and thank you very much for inviting me to be on your show. I feel very privileged.
Oh, no, I'm the one that's privileged to be in the presence of someone who actually knows what they're talking about. We live in a world of social media where so many people, um, so many people have been misinformed. It's just always good to talk to someone who actually does research and has information. And, someone just made a comment: making Black folks the boogeyman has to be addressed, or it is seen as a fact. And I do want to talk about these things because I think this year and the last year, at 2020 and 2021, has been a year of collective trauma. And, that coupled with being a part of a group that has to see a reflection of themselves being murdered tirelessly over and over again in the media, while being at home and not having an outlet, has to be, traumatic. And I just wanted to ask you, as we start, first of all, I want you to say in your own words, what moves you? Why you do what you do? And what is it exactly that you're doing in your work, before we even get into the topics?
Wow. So, I believe that I was born with a God-given gift to be able to talk to people wherever I go. And this has been since before I became a psychiatrist. Folks pour out their hearts to me. They share things with me in confidence, and it remains in confidence. I don't share it. And so I believe that God gave me that gift. I initially began my medical career, my medical education, aspiring to become an OB-GYN, an obstetrician gynecologist, delivering babies, providing women's health. And then I quickly realized in medical school that I was no surgeon. I did not have the God-gifted hands. I believe surgeons, like cosmetologists, not to compare the two, but really, I believe that people who use their hands for special talents, that you really have to be born with that gift to do just a consistent, awesome job at whatever it is you're using your hands for. And so I realized it wasn't for me. And as I pursued other areas or studies in medicine, psychiatry was a thing that was a really good fit for me. I was not intimidated by it. I was not turned off by it, as some of my colleagues were. I wasn't scared of the patients. And I felt this overwhelming sense of just passion. It was more than empathy. It was just feeling the empathy, the sympathy, wanting what was best for them, and feeling very concerned about these patients in the mental health wards. And I decided this was the route I wanted to take. Also, considering my own family history, I believe that a lot of us, a lot of people of color, melanated folks, brown, black, however you like to refer to yourself, African Americans, islanders, I believe that many of us have been exposed to different types of traumas, even if they're vicarious traumas, because of the history of Black people in America. The plight of Black folks in America is very traumatic, as what you were just explaining. So I do believe that this is my true passion, and this is why it comes so very easily for me. I believe in educating people, sharing information with them so that they can feel their best, be their best, live their best life, love their brains in the process, and not feel embarrassed or feel stigmatized by suffering from mental health challenges.
I'm so glad you said that, because I think that, as cliche as it may sound, you hear people say slavery ended so long ago. Like, why are you still talking about this? There is no Jim Crow anymore. Every Black people can use the bathroom. And I have a friend who's also she just wrote a book about the way that trauma is transferred through DNA, and how oppression and slavery and white supremacy and all of the things that are connected with that have really affected the psyche of people of color and Black people in this country and abroad, and how important it is for us to really identify how it is effective. I was at the mall just now, and I saw three young Black girls having lunch, and I walked up to them because a friend of mine, we have this practice where we just walk up to young Black girls and we tell them, hey, I don't know if anybody told you today, but you're beautiful, and I just wanted you to know that. And when people ask me why I do that, I'm like, because everything around doesn't tell them that. Everything around tells them that because they don't look like this, that this is what beauty is. And so I just feel like it's important for us to understand how that affects us and how we operate, but also how it affects the people who are not us and how they treat us. And so you do the important work, because I don't think I think people take for granted that mental wellness of many people is just not there right now. Not now, and not for a long time, and probably hasn't ever been there.
Yeah. Yeah. So you take into consideration what was happening up until COVID, until this pandemic began. When this pandemic came across America, we were basically stripped of everything we knew. Our comfort levels were stripped. So much of what defined many of us was stripped and taken away from us. We began this life of isolation. People said physical isolation, but many people felt physically isolated. You have to consider not just the young folks like you and me, but the older people, the elderly people who are already limited in their interactions and going out and being able to do things and see people. But you add to that, you complicate that by a pandemic and the fear of dying and seeing loved ones die, seeing friends and associates die, hearing about people dying. There's a lot of vicarious trauma in America. There's a lot of vicarious trauma now across the world. And so COVID-19 has just complicated the mental health pictures for a lot of people. Listen, prior to the pandemic, anxiety and depression, it was pretty common. 1 in 4 people at some point in their lives have suffered from some form of anxiety and or depression. During the pandemic and after the pandemic started, the rise has gone up 200%. There's been an increase, 200% of folks who suffer from some sort of anxiety and or depression. Oftentimes, anxiety comes coupled with depression because people feel so awful and so blue and so down about and guilty about suffering from a disorder as common as anxiety, which is something a lot of people experience sometime in their life, whether it's anxious about going to school on the first day, being nervous about giving a presentation at work, anxiety in traffic, whatever the case may be. We have stigmatized mental illness in America so much that people rather die or suffer before they come forward and say, hey, I'm suffering from this and I need help. Help me.
So when we talk about, for example, where I come from in my community where I grew up, it was embarrassing to admit to having mental issues, right? My mom would say, I would say, I want to see a therapist. And they would say things like, you're not crazy. You don't need to see a therapist. What you need to go to therapy for? That's for crazy people. You've been hanging around these white people too long. Like those are the responses. And as a result, there was a prolonged, a long time before I was able to go actually seek the help that I needed to deal with an eating disorder, so very self-destructive eating habits, and just a bunch of issues that stem from the things that happened to me when I was a kid. So now when I talk to my friends, many of them share the same sentiment. So I wanted to talk to the people who are watching and will be watching and listening about what exactly is getting help in terms of getting psychiatric and psychological help, because I know people, friends, loved ones who have children who are struggling with mental illness, and the stigma maintains the chains on these people who can otherwise have fruitful lives if they get the help that they need. And so I just really wanted you to explain in the simplest form what it is to actually go and seek help in terms of getting therapy. And I know it sounds very elementary, but I guarantee you that it will help someone, because the way that people process going to therapy has been so daunting for me. Just like, that's what you think, really? So I just wanted to, from a person who actually does it.
Yes. So I'm smiling because I love the question. I love the question because it's the most misunderstood specialty in medicine. People do not understand the mental health field, and they don't understand how to seek care, and they don't know who to go and see. And it can be very complicated because, mental health treatment was once considered something that only rich folks did. If you had money, the way you proved that you had money was going to see a therapist and telling your girlfriends or, your guy friends, oh, I'm seeing my therapist this week. I go every week for an hour. So, seeking mental health care, right? There's so many different ways to do that. There's a lot of different specialists, a lot of different occupations who claim to treat mental illnesses. And so I'll start with myself. I'm a psychiatrist. A psychiatrist is considered the highest level of care for someone seeking mental health treatment. A psychiatrist is a physician. We go to college, we get a bachelor's degree. For the most part, some folks might do 3 years and then go to medical school. But after college, you go to medical school. You're there just like all the other people training and learning to become physicians. You're in medical school for 4 years. You're learning everything every other physician or medical student is learning. Once you finish medical school, you have to do a residency. So for physicians to become specialists at whatever field they're in, you have to do that additional training. If you don't, you do what's called a 1-year internship and you're considered a general practitioner, a GP. But if you want to become a specialist, like a gynecologist or an oncologist who treats cancer, or a psychiatrist, someone who treats disorders of the brain, we study psychiatry and neurology during residency for a total of 4 years. So for about 12 years, we're studying and learning the body, the brain, medicine, all forms of medicine. And then when you get into your last 4 years, you're studying under the leadership of other psychiatrists. Most of them have been board certified, and they've been practicing psychiatry for some years, and they're helping you and they're teaching you along the way. Psychiatrists can prescribe medication because we are physicians. I say physicians because a lot of people can be doctors. Anyone can go and get a postgraduate degree, whether it's in math and English and social work and psychology, and be called doctor. But psychiatrists are physicians. We're medical specialists. people who specialize in psychiatry and neurology. And you can be a doctor of allopathic medicine, those are MDs, and you can be a doctor of osteopathic medicine, which is a DO, which is myself. I attended an osteopathic medical school. Those are the two main branches of medicine. And then you go on to do your residency. So apart from a psychiatrist, let's say someone does not want medication, psychiatrists, we prescribe medicines, and we also can conduct psychotherapy. We're trained to provide psychotherapy to patients, and that's what you were alluding to, and that's what I mentioned with folks going to talk to someone, sitting down, having a formal dialogue between you and your therapist where you process whatever you have going on in your life. And people have this misunderstanding where they think you have to have a problem to see a therapist. You don't have to have a problem. You don't have to feel depressed. You don't have to be anxious. There doesn't have to be a fire that you're trying to put out in your life. You can go see a therapist just to go and process, to talk to someone who's a professional and who's been trained to do that. The other types of therapists, psychologists would be the next highest level. That's a person who attended college for 4 years, went to graduate school to get a PhD or a PsyD, which is an additional 4 years, and they too can do a residency or an internship to study the type of psychology they want to practice, whether that's forensic psychology, which is dealing with people who commit crimes, or a clinical psychologist, which is someone who provides psychotherapy, a research psychologist. So there are different types of psychologists. Those folks do not prescribe medications. However, the caveat here is that because we have so few psychiatrists in America, there has been a push in some states and also on Indian reservations and also by some branches of the military to allow psychologists to go for training to learn how to prescribe psychiatric medications. The other types of therapists are master's degree levels. These are people who can be licensed clinical social workers. They go to college and then they do 2 years of graduate school to get a social work degree, and they sit for an exam and they become licensed. There's also therapists who attend college for 4 years, and then for 2 years, they study a program called mental health counselor. So they become a licensed mental health counselor after they complete their 2-year degree and sit for their exam. There's also marriage and family therapists. These are folks who go to college for 4 years and they complete 2 years in a program for marriage and family. And all of these 2-year people can go on to acquire an additional 2 years of study so that they qualify to be called doctor. So they can study and get a PhD in their field, whether it's social work or mental health counseling, or some folks will major in psychology as a master's. So people can move forward and complete another 2 years, of schooling and be called doctor because they have a doctorate in their specialty. And then in addition to these people, we have some folks who consider themselves life coaches. And there are different programs that have been created for life coaches. Some people are life coaches for business. Some people are life coaches for relationships. Some people are life coaches for divorce. So they can kind of become specialists in whatever field or whatever aspect. A financial life coach, I mentioned business life coach. So those are all the different people you can seek care with. And the way you find someone, the number one way is people will go through their primary care physician, their PCP, or the pediatrician if it's for your child. And most people are embarrassed to seek out mental health right away. They'll go to their primary care first and say, I'm not sleeping right, my appetite is not right, and things are not well in my household, and they may cry. And the primary care doctor, if they're a student, they're spending the time with the patient, will say, hey, I think you should go and see a mental health specialist or a mental health professional. Depending on that primary care's relationship with mental health professionals in the community, they may have a direct link to a psychiatrist, as I have some colleagues who are primary care doctors and they refer their patients right away to my office. Here we have all different specialties, so we're able to provide the different levels of care for mental health. And then now, since Obama created the Affordable Health Care Act, that has created the provision to allow people to go directly to a mental health specialist. Prior to that, you had to get a referral. Most
Mhm.
insurance plans required a person to get a referral from their primary care, which is another reason why people will go to the primary care first. They needed a referral so that they could have permission to see a mental health professional and for the insurance to reimburse it. What we
Mhm.
realized is that that has been impeding people from getting the help that they needed when they're in a mental health crisis, let's say. Because if you're down and out and severely depressed or been in your house because you're too anxious to go outside, most people are not able to really direct themselves and advocate on their own and be organized enough to reach out and call their primary care and say, hey, I need a referral to see a mental health specialist. So that provision has actually made it a lot easier for people to go straight to, don't pass go, don't stop, don't collect the $200, to go straight
Mhm.
to a mental health specialist.
I
Sorry.
appreciate you. No, I appreciated that because I think it's important for people to understand there is so much misinformation. Like people don't know the difference between a psychiatrist and a psychologist. Now, I wanted to really I wanted to get into medication because one of the things that is also stigmatized is that medication. For example, I'm a performer, so people will say to me, "Don't let them put you on medication. It's going to make you solemn. You're going to be you're gonna lose your zest on stage." Actors also struggle with this. A lot of performers are told not to use medication, but beyond that, you're told, people who take medication for depression end up killing themselves. Like that, there's so much information and or misinformation around medication. I wanted to talk to you about what does that mean in terms of the brain and how important and imperative it is for people who are bipolar, people who have schizo disorders, and people who have real issues with their chemical imbalances in the brain and wanting to have some normalcy in life.
You asked some really good questions. I love it.
Thank you. It
Yeah,
comes
these are
right.
good. And so, and this actually, I didn't mention another level of care for patients. Psychiatric nurse practitioners are also the newest thing. So they don't do psychotherapy. Some of them have actually pursued additional training to learn how to conduct psychotherapy. But for the most part, they're prescribing psychiatric medications, which, to answer your question, psychiatrists can prescribe psych medications. Any physician can prescribe a psychiatric medication, but most physicians who are not specialists in psychiatry are uncomfortable in doing that because if you don't know what you're doing, these medications can be very challenging, and if you don't know how to manage them, it can lead to a bad outcome for a patient. A psychiatric nurse practitioner is someone who has a nursing degree, a bachelor's. Typically, they've done nursing a little bit, and then they apply to go into a nurse practitioner program, which is, again, is a master's level. So they study for 2 years, and then it's specifically in psychiatry. They do some rotations, and then they're considered qualified to prescribe medications. So their education is nowhere close to what a physician, a psychiatrist is learning and what they're doing to manage psychiatric medications, but they scratch the surface a little bit. They're able to manage a lot of different conditions in psychiatry. Now, medications scare a lot of people, and they should not. If you have a savvy psychiatrist, a savvy provider, a person who is well informed, well educated in the management of psychiatric conditions, this is someone who actually sits down with you and listens to you describe your timeline and your symptoms and your history. They don't just write a prescription for you after they verify your name and your date of birth and then give you a prescription. I've had patients tell me that this has happened to them where they are they go to see a psychiatrist or a provider, and they haven't even told them their story. They haven't told them why they are there, and the person gives them a prescription for a medication. It's important that that person understands the symptoms that you've been experiencing, the amount of time you've experienced these symptoms, so that they can then make a very well-informed and create a treatment plan for the patient. And the patient also, you should receive education from that practitioner. They should explain to you, this is what I'm appreciating from you. This is what I'm hearing from you in terms of your symptoms. This is the diagnosis. This is what I believe we're dealing with here. And these are the recommended treatment options or medication options. And they should explain to you the possible side effects for the different medications they're recommending. They should explain to you the benefits of taking the medication, so that way the patient can be a well-informed consumer and they can make a good decision. There's all sorts of medications out here. Psychiatric medications have been around since the mid 20th century, I would say. And there's different categories of medicines. We got medications for depression. We got medications for anxiety. We have medications for bipolar, for schizophrenia, for schizoaffective, like you were just mentioning, for OCD, for eating disorders. And some of the medications can be used for more than one or two things. Some of them are FDA approved to treat several different types of disorders, and some of them are used off-label as well to treat different disorders. So medication, depending on the circumstance, it could be the best thing that can happen to a person. And there are some patients where medication is not indicated. I've had patients who come to see me and they think they need medication, and I explain, I don't think this rises to a level of you requiring pharmacological intervention, needing a medication. I think first we should start with psychotherapy. We should start with some alternative interventions like getting outside, getting more sun, getting fresh air, doing some exercising, eating better. We ask people about their nutrition. We ask people about how much water they're hydrating with. How much water are you consuming? Most Americans have a horrible diet. We eat the worst in America. We are the most obese country, and we don't drink a lot of water, and your brain requires hydration. So the question about medication is, yes, if you're seeing a physician or a provider who is well-rounded, that person will talk to you about all the different options in treating your disorder. Now, there are some disorders that require medication to manage that person's symptoms. I would say schizophrenia and bipolar, and also severe major depression. Those three are on the top of my list of requiring medication to create resolve for that person, or so that person can stabilize. And there's some types of depression where if you don't take the medication, yes, the depression will remit at some point, but it'll just take a lot longer for that to happen. And in the process, you're uncomfortable, you're unhappy, and sometimes people become suicidal when they're sad and down and out and depressed, and they got all these things going on, and especially if it's combined with stress, life stress.
So somebody just asked, would you encourage mental health online therapy treatment? Some people are hesitant about this due to sensitive conversations being recorded.
Great question. And I totally agree with virtual health or telehealth. With COVID-19, everyone's heard the word pivot. People are so sick of the word pivot. They don't want to talk about the word pivot. But a lot of practitioners, whether it's for mental health or even for physical health, even internists and family practice doctors, when COVID was first occurring, a lot of people turned to telehealth to provide care for their patients. And we're still in virtual health. We're still managing people virtually. Don't worry about the confidentiality. It's completely confidential. We're using platforms that are HIPAA approved. We have to use HIPAA approved platforms. I've been on some social media platforms where I see a mental health provider say, oh, I can do a consultation with you on Instagram. We can do it on Instagram Live. That's not HIPAA approved. And so I would not encourage someone seek that type of treatment. But if they're using things like Doximity, if they're using Blue Jeans, these are just a couple of examples of what's approved to use for virtual health or telehealth. And some folks, before COVID occurred, I had some patients who couldn't come into the office, and so they opted for a telephone consultation or a telephone appointment. Granted, at that time, insurance was not reimbursing for virtual, whether it was video or phone sessions, but people would pay out of pocket for that. for the convenience. And also, just some people choose to conduct their services by phone. So no one should be recording what you're saying. It should not be happening, and it's these platforms have to be HIPAA approved.
Now, A Musa Ahmad wants to know what's the best way to spot a doctor who's pushing medication for big pharma rather than for therapy? Like, what are some of the characteristics of the doctors who and you explain this, who are going to sit there and have a conversation with you? What should you be looking for, so that you can identify that these doctors are not just trying to bill your insurance?
So they spend time with you. They
Mhm.
give you the time. They start out allowing you to speak. Establishing rapport with you is important. They allow you to share your timeline. I ask every person about their history. Our providers here ask every patient we meet with the first time, the second time, and because it takes a while to learn someone's history, to acquire all of that data and information. So we're asking you about your past psychiatric history, if there's any. We're asking you about any substance abuse history, if you have any, if you use alcohol. If so, what's the quantity? How does it affect your life? We're asking you about nicotine and tobacco. We're asking about recreational drugs, if you do any. We're going to ask you the specifics to that as well. We want to know your past medical history too. We want to know if you have a history of a head injury, if you've ever had a seizure, if you have anything like diabetes, which is elevated blood sugar, if you have elevated blood pressure, if you take medications for any of these physical health problems, if you've had surgery before. And if you're a woman, we're asking, when was your last menstrual period? Have you been pregnant? We're asking you all of these questions, and then we're going into the social history. I want to know, where were you born? Who raised you? Who were you raised with? What was your
Mhm.
childhood like? What hobbies do you have? What do you do when you're stressed? How do you cope? What type of work do you do? Did you graduate high school? Did you attend any college? We're asking all of those questions, and we're delving into your family history as well. We want to know your family physical health history, if anyone has cancer, if anyone died early from a heart attack or stroke. And we also want to know about the family mental health history. If there's anyone in your family who's ever been diagnosed with a mental illness or has shown signs that they may have had mental complications or challenges or any suicides. And we're asking you about that as well. If you've had thoughts about not wanting to live, about wanting to kill yourself, if you ever cut yourself or burned yourself to relieve stress, we're asking all of these things. So that's a good indication if a provider is a good provider. They spend the time and they want to learn who you are. They want to learn the information about you. And they allow you to talk. They allow you to describe what brought you into the office and how that situation may be affecting you. And they may offer to do a session or sessions with your mother or your father if that's been a challenge for you in your life, or if that has caused it has been a relationship that caused problems for you. Or they may invite your significant other in on a session. They may recommend that you have a family session that includes the children. So that is a good indication. And that person also asks, how can you tell if a physician is pushing big pharma? So here's the best indication. Big pharma, pharmaceutical companies come around because there's a new medication that's out, right? These new medications don't come generic because they're new. So they only come brand name. And to get the information to the physicians, to the practitioners, to the nurse practitioners, the PAs, and the doctors, these pharmaceutical reps will come around to the offices and to the hospitals and educate you about their product. Now, back in the day, this was really way, way back in the day, they used to do expensive events, like take you to a football game, take you to a baseball game, and talk to you about their medication. But people became very suspicious of that and wondered, is this why our medication costs so much? Because you guys are whining and dining the doctors. And so the program where I trained, the University of Maryland, in 2003 until 2007, my training program said it's against the rules and regulations for pharmaceutical reps to come to the hospital and provide events, to do events for residents, because it doesn't look right. It looks unethical. So that created a new culture for a lot of other hospitals as well. A lot of hospitals followed suit. So the way you can tell when a physician is pushing big pharma is this: you've never had a medication ever in your life, but they want to give you the newest thing that's on the market. They're like, hey, this just came out, last year. I got samples of it. Let's try this. instead of trying you on the medication that's been out, for 10, 20, 30, 40, 50 years. Because remember, insurance companies will pay for, there's different tiers for your pharmaceutical benefits, for your medication benefits. So if a medication is generic, more than likely the insurance is paying for that with no issue. If it's a medication that's new to the market, it's brand name only, you may have to get what's called a prior authorization. You got to get special permission to use it, because the insurance wants to know that the doctor is being a good steward of of money, that they're not just prescribing you the newest best thing that came out when they haven't tried you on the oldest medication that's been
Mhm.
around, available, and has proven to be effective. So I hope that answers the question.
It does. There have been several questions here. I bookmarked this one. It's hard to have conversations about race with a therapist who might not be qualified or could understand. Any hints on how we might navigate this? Someone else said they were having a conversation about microaggressions with the therapist, and the therapist told them, this is not a place for you to come here to complain. So also somebody else said that made the point that in communities, marginalized communities, mental health care is not as accessible. So I wanted to ask you a two-part question. One was, how do you find a therapist that can deal with those issues? Like, I understand that on a very deep level, wanting to speak to someone when you're dealing with the realities of what we're seeing. I mean, George Floyd was just one example of the things that people in the Black community would have had to witness for a very long time, since the beginning, actually, and that does affect the psyche. So how do you find a therapist that is that works for you in that way? And then the other thing I wanted to ask you was, do you know of any resources that we can share with people who may not have proper health care or money, and that can have access to some sort of health care? Is there a database? Is there an organization of people who actually donate services or stuff like that?
Absolutely. So I'll answer the latter question first.
Okay.
The National Alliance on Mental Illness, NAMI.org,
Mhm.
NAMI.org, is a great site. It's a site that provides education and information about different pathologies and mental health. And it also provides information for different community mental health centers, different community programs, different programs for people who have limits or don't have the funding or the insurance to access care. That's a national type program. They're in almost every big city. Also going on sites like the American Psychiatric Association,
Mhm.
the American Psychology Association. Most of these national sites will have information on seeking healthcare or mental health care. The other option would be in your town. Go on your hospital's website, call the emergency room and ask to speak to the social worker. Ask the social worker to give you a list of community mental health centers. If you have access to Google, the computer, to a smartphone, a laptop, whatever it is, Google community mental health centers, and Google will search for those places within a certain mile radius of where you live. A lot of major cities and small towns have some sort of community mental health center where someone can seek care. And so I would start with some of those things. And Google is always a good way to try to find information. Now, the cultural sensitivity thing, man.
Mhm.
So as bad as COVID was, COVID also exposed a lot of the racism that had been occurring in America for over 400 years. As bad as COVID was, it allowed people to see what's really happening in America, because everyone was home. Everyone was recording things on their smartphones and sharing information. And so we were able to see, and we weren't busy. A lot of people were home from work. They were working from home. And so you had the time to be on social media, to watch the news and see all of these things in the headlines. And so cultural sensitivity has become a major thing now.
Mhm.
Everyone has jumped on board with creating a culturally sensitive environment at at jobs, on the job for different companies, including not just hospitals and mental health facilities, but big companies are doing it. Gucci has decided to create a program where they hired someone to manage that. So the activation of our stress response with the pandemic, and then all of the racism that we've seen, has created this system. But it's also shown us who is not as insightful when it comes to race relations and dealing with people. It is also shown that some people who believe they're not racist really have to learn more about culture and the differences between races and nationalities and ethnicities. People are lacking that information. So the way you find a mental health professional who is culturally sensitive is, number one, start with someone who looks like you. If you're a minority, if you're someone of the African diaspora, see someone who's of the African diaspora. If you're someone who's from, let's say, I'm in South Florida. We have a lot of islanders here. We have probably more islanders than we do African Americans, I would think. So we have Haitian mental health providers. We have Jamaican mental health providers. We have folks from South America who are mental health providers. We have African American mental health providers. So start with someone who looks like you, because the assumption you would make is that this person has lived the life of a person who's been silently discriminated against, at least if it wasn't macro aggressions that they've experienced. So depending on that person's background, you take a chance and you make that assumption initially that this person is in the know and they understand it, and that they understand your culture because they were raised in it and that's who they are. When you start with someone who, let's say, is of the majority, they may not be very sensitive to the challenges that we've had in this country. They may be someone who, like you said, Aida, says, oh, slavery was, whatever, 200 years ago, over 200 years ago, 300 years ago, that's been gone. Why are you guys still angry? And there are some therapists who really do talk like that in sessions. And so if that happens, or if they tell you you're complaining, fire them on the spot. I would walk out of the session. I wouldn't even stay and finish the session, because the thing that people forget when they access medical care, whether it's for a physical problem or a mental health problem, is you are the consumer. You're the customer. You're the patient, but you're the customer, you're the consumer. And you should love the service you're receiving. You should like it. And if there is some sort of difference between you and your provider, talk about it. And if you cannot make amends, then just tell them, I'm sorry, you're not a good fit for me, and move on to the next person. And it happens. And sometimes it happens by no fault of the practitioner. Sometimes it's a challenge that the patient is experiencing at the time that causes, to end the patient-doctor relationship. But just tell that provider that I don't think you're a good fit for me, so I'd rather not see you anymore. And sometimes people are not good with that either, because they feel like it's sort of confronting a situation. Just don't schedule any further appointments. And if the provider calls and says, hey, I haven't seen you in a while, I was wondering where you are, you can just say, oh, I'm okay, I decided not to come back. And most providers will accept that and leave it alone.
I wanted to quickly not forget to talk about sex. Let's talk about sex, baby, because I think one of the things that I have, and I do want to have you back so that we can have a full conversation about this. When we talk about sex, there's a lot of stigma, specifically when it comes to people of color, because people of color have been over-sexualized in this country and abroad, and fetishized and objectified and dehumanized. And sometimes I feel like the sexual part of who we are, we're stripped of it because there's so much shame and so many issues that come with that. And I wanted to talk to you about it because I watched some of your videos, and you did talk about, oral sex, and people have questions about it, because that is also part of our mental wellness. Sex is a function of who we are, and as people, it is part of how we live our lives. It's how we all got here. And when you, like, for example, someone who's been sexually assaulted or has had some type of sexual trauma, it complicates your life because it pollutes something that is a part of who you are. And so I wanted to talk to you about, sexual wellness, sexual wellness, or the proper attitude and mental wellness when it comes to sex, and some of the things that you deal with as a therapist when you talk to your patients about sex.
So it's funny you should ask that, because last night I did a show on my Facebook page live and
Mhm,
talked about women and sexual appetite, women and sexual health, because
mhm,
sex is so complicated for women in comparison
mhm,
to men. There are so many things that have to be in line basically for women to really feel satisfied, or to be able to go through those different phases to enjoy sexual activity. Um,
mhm,
so, sexual wholesomeness, one of the things that affects people and can affect people adversely is how you're raised and how you're taught to view sex and intimacy. If you're raised in a household where you see your parents or your guardians showing one another affection, if your parents talk to you about sex and intimacy and personal relationships and allow you to ask questions, you'll be someone who does probably pretty okay in your relationships with people when it comes to sex and intimacy, because you weren't discouraged from talking about it. You were allowed to process it growing up. You learned from your parents, as opposed to hearing it on the street or at school, or watching some video that someone may have snuck and sent to you. So it's important to remember this as we're raising our children. You have to allow them to ask you questions. You have to be able to talk to them about sex and relationships and teach them. Don't force them to go to the street to learn this information. And talking to your children about sex, you got to talk to them about their bodies. You have to talk to young girls about what will happen when they are entering puberty, and they start to menstruate and they start to grow breast. And you have to talk to little boys about the wet dreams they might have at night. And all of these things are important discussions to have, so that the children feel comfortable as they're growing older. And talking about body parts, I have to tell you this quick story about how I learned I had a clitoris, or a clitoris. I was
mhm,
in 5th grade, and I was on a rope, and I was climbing the rope, and it had all these knots in it. And I'm climbing all the way up to the top of the rope. And as I'm climbing, my genitalia is rubbing the knots on the rope.
mhm,
And I get to the top of the rope, and I'm like, oh my God, this feels so good. And I'm clinging the rope. And my gym teacher is looking up, and I'll never forget this day. And he's looking at me like, what's going on with her? Now, my parents were my dad talked to my brothers and me about our bodies and about sex and all these things. And my mother was open, but we never had a conversation about body parts. And I didn't realize what happened to me until way later in life. I pretty much was stimulating myself as I was climbing that rope.
So how many times did you go back to climb that rope after? I got a rope in my, she's like, I got a rope right here behind my chair. Um, it's so funny because I think we all have stories like that. And, like my mom that my family was Seventh-day Adventist. So not only did we not talk about sex, we were discouraged from being in any way sexy or attractive. I wasn't allowed to wear pants. I couldn't wear earrings. There was no makeup. And so the whole idea of sex just being something that you do to have children and not for pleasure is something that haunts a lot of us, because we have to walk around trying to figure out how to deal with the shame of wanting to be sexual people without being, categorized as being hoish or whatever the things that people say. There are a lot of women who have said sex is overrated here. They don't have a desire to have sex. There's a lot of trauma that leaves you there, right? Because sex is it's supposed to be an enjoyable thing that is supposed to be enjoyed by both both people, not genders, but by both people who are having sex. And for some reason, we've all been socialized into believing that sex is supposed to be something that is for the pleasure of men. So what are some of the things that we can do as women to reconnect with our sexual selves, to begin to enjoy sex again and to seek it and want to have it?
So, first of all, if you've been traumatized, if you have a history of sexual traumas or physical abuse, sometimes physical abuse can impede the process too of enjoying and of enjoying sex.
Hmm.
Speak to a therapist, talk to a psychotherapist, process the trauma so you can sever those emotional ties. So you have to address the trauma from your past first. The second thing is acknowledge that it's okay, that it's healthy, and that sex is not just about procreation. Sex is important for as a stress reliever. It helps to manage blood pressure. It helps to enhance our immunity system, our immune responses to things. It's a great stress reliever. And once you've had an orgasm, it's kind of like, dang, how can I not experience this again, right? You only have one life to live, and you can't live that life being concerned about what other people think. You have to decide your own terms and live your own life. And not being sexually active, not allowing yourself to let go, because sometimes people, not just the traumas, but some folks experience anxiety or have severe forms of anxiety, and they're not able to let go. And when you can't let go and relax, it prevents the process of climaxing, experiencing an orgasm. And so people have to deal with those issues at the root first. So that way they can go on and move on, and they're able to form a great relationship with someone. And then they're able to relax and enjoy the process of making love, having sex. And masturbation is important too. You mentioned Seventh-day Adventists. I remember growing up as in the Apostolic Church, and it was discouraged to masturbate. But
Mhm.
nothing wrong with masturbation as long as it's not excessive. Your kid is masturbating in the bedroom, so he's late to school every day. That would be a problem. You have to talk to them about that. But masturbation is healthy, and it teaches a person about their body, whether it's a man or a woman.
Are there any books that you would recommend that some people who are not ready or cannot afford to go to a therapist right now to but are there any books or videos or anything that you could recommend that people could seek in order to start dealing with the issues?
Listen, I'm looking around my office like, oh shoot, which book can I recommend? Um, you know, I there are a couple of books I would say, and these are common books that people read, especially when they're in positions of leadership or they're on a team. I would start first with. Do you mind if I pull a book or two? Let's see.
No, not at all. I would love for you to do it.
Okay, I like this book, When to Speak Up and When to Shut Up, because it teaches us about emotional intelligence. John Maxwell's Leadership 101 is a good one because it teaches you not just about being a leader, but being a team player. I like all of these books that teach you about being a team player. 10 Rules for High Performance, Pulling Together. So these are not necessarily mental health books, but they teach you about your personality and your interactions with people. And of course,
Mm-hmm.
this one. So starting with some of these, and also if you will allow me later to drop some other book options that are more specific for mental health and wellness, I can do that as well.
And what about books about sex?
I'm currently writing one, but I've been writing that for a long time.
Oh, good.
I don't have a recommendation about a book about sex. I would say just
Not the
go with
Kama
your own
Sutra.
fantasies. What's
No,
that?
not the Kama Sutra.
Not the Kama Sutra, no. Allow yourself to fantasize and have fun.
And is porn healthy? I'm looking at. I'm asking for the people.
Gotcha. Limited amounts of porn is okay. Anything in moderation is okay. When it's excessive, it's a problem. So yeah, porn is okay if your partner's okay with it. Let's say you're in a relationship and you have to watch porn to get yourself in the mood before you and your significant other make love. That may be a problem. So if you're using porn in that way, then I would say go and see a therapist, and try to seek a sex therapist, someone who specializes in sexual dysfunctions, because that's who you'll need for that type of circumstance.
And you're that type of doctor as well, right?
I did not attend sexology school classes, but again, I'm a physician and I'm board certified in psychiatry and neurology. And yes, I do conduct sex sessions and therapy sessions for couples to help with their relationships, and also to help enhance their bedroom, the life in the bedroom and the bathroom and the kitchen, all of the above.
Okay. All right, doctor. All right. Awesome. Thank you so much for being here. I would like for you to come back. I would love to just do a Q&A session with you where people could just ask the questions that they really want to ask, and feel like they can't, because I think when we talk about all of this, mental health, we talk about sex, there's so much stigma and shame that people don't get the information that they need because they're afraid to ask the questions for whatever the social repercussions might be. But I think it's important for us to have these conversations.
And I agree wholeheartedly, and would love to come back and do a Q&A.
Yes. And so tell people where they can find you. And you said you did something online yesterday. So please let them know how they can be connected to your community, and so that they can support and follow you, and be, a part of what you're doing.
Sure, absolutely. On Instagram and Facebook, I'm Dr. Delvena, as it's written, DRDELV as in Victor, ENA. I do have a YouTube channel. It's Dr. Delvena, as it's written, with my last name, Thomas, THOMAS. And I have a podcast that I started in May during Mental Health Awareness Month. It will be a year this coming May. It's Brain Love Podcast, and I talk about everything on that podcast as well: sex, relationships, depression, children and teens with depression, everything you can think of that's associated with the brain.
Nice. I want to say thank you to the community and the village who showed up today. People will continue to watch this, and you might get people sending you questions and DMing you, because we have a really smart and sophisticated audience that shows up for the purpose of the greater good. But I want to say thank you. I appreciate you being here. I'm from South Florida, so it's good to know that you're down there in our community doing the good work, because there's a lot of issues. And I'm from Miami, and all of the racial and ethnic and cultural clashes that we have in the city of Miami, which are all function as a result of white supremacy, sometimes can be a lot. So it's good to know that they have you down there. And I may be calling you myself so I could talk to you about my own rope adventure.
My door is open to you, and my phone as well. Thank you so much, sis, for bringing me on to talk about brain love and to help folks as much as I could. I appreciate it. And you continue doing what you're doing, helping people and spreading the word.
Thank you. So everybody go subscribe to Brain Love. Make sure you follow Dr. Delvena. And next week we will be back. Marsha Warfield is going to be here. We're going to be talking about comedy. They said we really want you to keep showing up and keep sharing the message. Have a beautiful weekend. Thank you. I love us, and I won't stop. So have a great day, everybody. Thank you for coming out.